Imagine waking up every morning to a stabbing pain in your abdomen. A sensation so relentless, it feels like your nerves are screaming for help. You visit one doctor after another, but the answers are vague and the relief is fleeting. Now, picture this: over 40 medical experts, each with years of experience, gather to solve the enigma within you. Sounds like a scene from a gripping drama, doesn't it? But this isn't fiction. It's the real-life story of a woman whose mysterious pain baffled even the brightest minds in medicine. Stay tuned, because what they discovered about her nerves might just change how we think about chronic pain forever. Abdominal pain is one of the most common complaints in medical practice, yet its causes can range from the mundane, like indigestion, to the downright puzzling involving rare neurological conditions. This woman's case wasn't just unusual, it was extraordinary. The pain didn't align with typical patterns of gastrointestinal issues, and standard treatments like antacids and diet changes had no effect. This is where the story takes a fascinating twist. The focus shifted from her digestive system to her nerves. Yes, her nerves were the culprits, and the journey to uncover why turned into a medical thriller. What makes this story so compelling is how it shines a spotlight on a lesser-known condition called abdominal cutaneous nerve entrapment syndrome, ACNS. This condition occurs when nerves in the abdominal wall become compressed or irritated, leading to chronic pain that's often misdiagnosed as something more severe, like appendicitis or even cancer. Studies suggest that up to 30% of chronic abdominal pain cases may be linked to nerve issues rather than internal organ problems. Think about it. How many people suffer unnecessarily because their pain is misunderstood? It's like blaming the engine when it's really a problem with the wiring. Here's the kicker. Diagnosing ACNS requires a shift in perspective. Instead of focusing solely on internal organs, doctors need to think about the layers of tissue in the abdominal wall. This is where a simple yet effective test called the Carnot sign comes into play. The patient lies down while the doctor applies pressure to the painful area, first with the muscles relaxed and then tensed. If the pain worsens with tension, it's a strong indicator that the nerves, not the organs, are the source of the problem. It's like finding the faulty wire in a complex circuit, a small discovery with huge implications. The treatment for nerve-related abdominal pain can be equally surprising. While medications like nerve blockers or antidepressants can help calm overactive nerves, physical therapy and even mindfulness techniques have shown promise. In the case of our patient, a combination of targeted nerve injections and therapy provided significant relief. The most astonishing part? She had been living with this pain for years, and a relatively simple solution was just waiting to be uncovered. Imagine the emotional roller coaster of finally finding relief after such a long journey. Now, let's talk about the big question this story answers. Why does chronic pain often go undiagnosed? The answer lies in the complexity of pain itself. Pain is a subjective experience, influenced by physical, emotional, and even social factors. This makes it incredibly challenging to pinpoint its exact cause, especially when it doesn't fit into traditional diagnostic boxes. Add to this the stigma surrounding chronic pain, where patients are sometimes dismissed as exaggerating their symptoms, and you've got a recipe for frustration and misdiagnosis. But here's the good news: awareness is growing. Researchers are delving deeper into the role of the nervous system in pain, uncovering connections that were previously overlooked. For instance, did you know that chronic pain can actually rewire your brain? It's called neuroplasticity, and while it sounds daunting, It also means that the brain can be retrained to reduce pain. Techniques like cognitive behavioral therapy and biofeedback are proving to be game changers in this field, offering hope to millions who suffer in silence. As we wrap up this incredible story, let's not forget the bigger picture. This woman's journey is a powerful reminder that medical mysteries are often solvable with persistence, curiosity, and a willingness to think outside the box. It's a call to action for doctors and patients alike to consider the role of nerves in chronic pain and to approach each case with an open mind. And for you, our viewer, let this be a lesson in resilience and advocacy. If you're dealing with unexplained pain, don't settle for vague answers. Push for deeper investigations, ask about alternative diagnoses, and most importantly, trust your instincts. Before you go, don't forget to like this video if you found it insightful. Your support helps us bring more stories like this to light. And hey,